Right, welcome to our annual Safeguarding PLI. Thank you for coming. I'm going to choose to believe that everyone else is watching it on live stream and not bunking off in sunshine. But I'm not going to say what I'd be doing. Right, okay. For people that don't know me, I'm Heather Innes. I'm a GP in Crooks and I'm a named GP for Children's Safeguarding in Sheffield. Lou Millington's the other named GP, but she's on holiday. So can everyone hear me okay? Yeah, okay. Right, so this is the agenda for this afternoon. We've had to change it. Somebody kind of called in sick literally about 2 hours ago. And so Kitty and Nikki from the safeguarding team have really helping us out at the nth hour, so you'll have to be kind to them because they are winging it a little bit, and I think cutting down a 2-hour presentation into 30 minutes. So this is what we're going to be doing this afternoon. No planned fire alarms. I'll let you read that because, yeah. Most of you have probably been here before, but there's toilets over there. Don't smoke in your seats. Right, so I'm going to go on to mine. I'm going to race, you probably know most of this. I'm going to race through it a little bit. If there are any questions, though, you can ask at the end. So I think most of you are quite familiar with a lot of this stuff, but we do get asked it again and again and again, and I get quite a few emails still, so I just thought I'd just do a quick refresher. But if I finish a bit early, then we can move on to the more interesting bits. So online record sharing. Wait a minute. So I tried to do fancy things in my PowerPoint, and now it's okay. We're getting there. Right. So as you all know, before patients didn't have automatic right to see their records online; they'd have to ask for it, and then we could then decide from what point they're visible or whether we want to let them see their records at all. And and GPs could hide from view things that they didn't want the patients to see. We could also decide what level of access to grant. So we quite often granted like coded read code access, but they wouldn't be able to see like the free journal bits. So from whenever your practice had a switch on. Ooh, I've lost my power. Does it come back? Yeah, okay. From whenever your practice's switch on date was, which was any time in the last couple of years, because it was phased in the end, all patients from your switch on date who are 16 or over, don't know why that's keep going off. Try that one. Okay. Right, okay. So, if they're 16 or over, they can see their records from the switch on date. Now we need to decide what our patients can see as things are added on to the records. So what's visible? I've written it all down. There was a lot of speculation about what was visible, but the things that aren't visible are things like tasks, reminders, things that are coded safeguarding relevant, but you do need to just remember that patients still have a right to legally request to see things that they can't automatically see. So that's what they can see. So it doesn't switch on till they're 16. It can be switched on earlier. So if you've got a Gillett competent teenager, I'd say, who's maybe 14, 15, who wants online access to their records, then you can decide to turn it on for them. And parents, their access to records, if they've had it when their child's earlier, usually automatically switches off when they're about 11 or 12. In our practice, we still get a few parents that ask for it to be switched back on again, If that happens, then we tend to have a consultation with the parent and the child. We talk about the pros and the cons of the parents being able to access their records, and then kind of decide together what the best answer should be. Should the child have the access? Should the parents have the access? And I usually then tend to talk to the child about their future rights for confidentiality if things change. Now, if patients change practices, the important thing to know is that all the stuff that you've written, that you've hidden, so when they change practices, the clock kind of resets. So the patient can only see their notes from the point that they register at the new practice. And that's because there was an IT glitch, and there was no way of ensuring that hidden entries from previous practice would still be hidden when you re-registered at a new practice. Now, of course, patients can still request retrospective access, and if they want access beyond the start of when they registered at the practice, you're going to have to treat that with the same considerations that you always did around what's in the records. So there were some wider considerations. There was lots of speculation when this first came in. Could patients see district nurse entries? Would they be able to see? Obviously lots of organisations use System 1, which is what I use. So actually, they can only see the entries that are through what's enabled through your practice and the smart cards. So if you've got locums that you've given smart card access to, or ours role staff that have got your practice access on their smart cards, they can see what they've written. But if it's a district nurse entry or diabetes team or those kind of things, they can't ordinarily see those. So things you need to have a think about is patients that are lacking capacity or they're losing capacity, whether you need to have a think about doing audits around people who've got proxy access because they might see a lot more information than they used to, and domestic abuse where the perpetrator might be gaining access to the victim's notes. So basically we need to just think about not just what the patient's going to read and whether they're going to agree with you or be upset about what you've written about them, but also who else might be accessing those notes. So before online access was switched on, 15% already had it, to be honest. We used to mark people's notes as reminders at the beginning, but to be honest, there's so many things that pop up in clinical notes that probably didn't notice it most of the time. So you have to, which you probably already are, consider that everything that you're writing down, the patient can access and read. And I don't know what the experience has been in Sheffield around patients sort of talking about what they've seen. We've had a few complaints about patients wanting their notes changing because they just don't agree with what we've written or descriptive terms that we've used. And then just having a policy for hiding documents from the online record. So our admin team automatically forwards anything to me that they aren't sure whether it should be in the online record. Mostly things like safeguarding stuff, but there is other stuff as well. Patients inadvertently finding out that they've had a scan that shows they might have cancer, or an outpatient letter that's got third-party information or anything like that. So it's just, in your own practice, you should have a policy around that, really. The RCGP's got loads of stuff on the website about online access and has had for quite a while. So the main points to remember, this has come from the NAME GP network, is redacting anything that you think may cause harm to the patient. Just being aware of very casual comments, so things like saying, oh, things are better at home now, or husband's behaving a bit better, or something that is going to alert somebody else reading those notes to thinking, oh, well, why, what was happening before? And also, if somebody tells you, well, I'm not with that person anymore, don't let your guard down because they quite often go back to them. Discuss online access with your patient when appropriate. You could turn it off for them, you can deactivate it for them if it's decided that it may be in their best interests because of other people that might be accessing their records. And it's still being talked about at the moment that in future patients might be able to redact stuff from online view themselves. Now, this won't change their central GP record, but it would change what's visible on their app or however they're accessing their notes. Now, if things go wrong, this is just for safeguarding. You'll get a copy of all these slides later, but there is safeguarding is still worried that there are potential for harm with people accessing their notes. So if something goes wrong that's directly related to a safeguarding matter, then there's a link where you can record what happens. It's anonymous in terms of you shouldn't put any patient data in, but it's what they're collecting at the moment. So, does anyone have any questions about that before I move on to coding? Just because, or does everybody feel that they know everything they need to know about online access and what patients can see and what they can't? I still occasionally get people that are really surprised and didn't realise that it had been switched on. No? Good. Right, so coding. This is another question that's asked. Should I be using particular codes for safeguarding? Which are the right codes to use? This is complex, and there's always working groups that are trying to come up with a magical set of codes that we should use all the time. The bottom line is that you need to use the codes which enable you to find the information you need. You need to ensure that your staff have got safeguarding functionality enabled on their smart card access rights. So I think most practices are very well versed in this now, but certainly a few years ago we were finding that some people couldn't see certain safeguarding information because they didn't have safeguarding rights on their smart cards. When you when you're deciding to hide notes from online access, or you're saving documents, if you save them as safeguarding relevant, if you don't have safeguarding functionality on smart cards, the people that don't have that enabled on their smart card can't see any of that information. So it's just important that anyone that needs to see the safeguarding information can see it. One thing that keeps coming up is safeguarding node on system 1. I think we've generally, does anybody know about this? Yeah, so on system 1, there's a safeguarding node which sometimes other agencies are using, like health visitors. It's not in the new journal, and it's kind of hidden away in a little, if you go to the clinical box at the top, there's like a little triangle that shows there's something active in the safeguarding node, but it's a bit tricky to access it. I'm only mentioning it just in case anyone comes across information inadvertently, because I could do with knowing about it. GPs aren't using it, but some other agencies are, and again, we keep getting questions about why isn't everybody using it. I'm sorry I'm talking about System 1 all the time. Lou does EMIS, and she's not here today, so I can't see EMIS. And yeah, again, it's just worth remembering that safeguarding relevant coded entries can't be seen by everyone, so people that don't have safeguarding rights on their smart cards. So you just need to remember that if other people, like admin members, are doing searches for QOF, if they haven't got it on their smart card, they're not going to pick it up. CQC, CQC is a big one as well. There's CQC Mythbusters on the CQC website with lots of different topics around safeguarding. Anyone who's a lead GP for safeguarding adults or children who accesses our safeguarding channel on Teams, we've put together like a resource pack, and we've got a bit more information about CQC on there. If there's anybody here who's a safeguarding lead in practice, do you all know about our channel? Is there anybody that doesn't know about it? Who thinks they should? Right. If there's anybody that's a safeguarding lead in practice, either adults or children, and you don't know about our channel, then if you either email me or Lou Millington, if you know Lou, then we'll add you to it. So we have monthly supervision. So we do an hour, a lunchtime hour, Monday, Wednesday, Fridays, and we try and kind of alternate it each month to try and catch everyone. You can do it while you're eating your sandwiches. You don't need to be particularly concentrating, you don't have to have your camera on, but people often just want to ask questions, complex patients, stuff that they're worried about, stuff that they're struggling with, and we usually get a handful of people every month. If there's any other GPs, it doesn't have to be GPs by the way, or practice nurses or AMPs, who are struggling with a safeguarding issue and they want to talk to a group of us about what to do about it, then the offer's extended. So just email me or Lou, and we can send you an invitation for the next meeting is Friday week, I believe, at 1 o'clock. So, but it's really useful, and we regularly, Lou's better at this than me to be fair, but we regularly update the channel with new information, new policies that are coming out, news that you might want to know about, those kind of things. So, but for CQC, if you're a practice lead especially, you need to make sure you've got your policies up to date. You need to know that you can demonstrate that your staff have been trained to an appropriate level. They're very big on either evidence of multidisciplinary meetings or multidisciplinary working. So I was looking into this the other day. You don't necessarily have to show that you have full MDT meetings every month or every week, but you have to show how you ensure that you that you have good multidisciplinary working in your practice. You also need to show how you can flag up vulnerable patients and safeguarding. And how they can be identified to other staff members, and you also need to show that you've got safeguarding leads, deputies if relevant. If you're a very small practice, you might not have, but you need to be able to show that you've got somebody that's got an overview of what's going on, and also that they've got the relevant training for that role. I think we're getting near the end. Yes. So that was short and sweet, to be honest. So is there any questions? It's going to be quiet today. Oh, we've got one at the back. Is that a question? Hello? Yes,
just a really quick one about labeling things as safeguarding relevant.
Yes.
So does that mean that you don't need to also hide it from the online record? If you mark it as safeguarding relevant, it automatically...
Yes, it's automatically redacted,
and that's
yeah.
the same with the codes?
Yes.
Thanks.
Could I just ask, it might be answered in another bit of the afternoon, but to just clarify the level of safeguarding training that nurses and healthcare assistants need to do?
Right, so I can only talk from a children point of view. I'm not supposed to say, are we? Anyone that is, so with children, anyone that is seeing children face to face and involved with their care is generally, it would be a level 3 trained professional. So like nurses who are doing immunisations and those kind of things. And that's 12 hours in 3 years. Adults, I think, is 8 hours in 3 years. That's what I read earlier. Yeah, 8 hours in 3 years is generally what would be expected. I don't know what level 1 and 2 is off the top of my head, because all our clinical staff, I'd say, probably level 3. If you're a practice lead, you're meant to do 16 hours in 3 years. And we do like a lead GP event for adults and children every year. So again, if you've kind of been left off the loop to come to those, let us know. Our last one was in July for children, and we are meant to be repeating it online in October. I'm not quite sure how we're doing with organising that at the moment, but that was the plan, and we did that last year and it worked quite well. So we're trying to do a face-to-face event and also an online one for people that missed the summer one. Anything else? No. So I've just mentioned, I was meant to mention this at the beginning, but I got nervous and then forgot. So there's lots of stalls today. Over in that corner, we've got the corner, which is kind of appropriate, who deal with drug and alcohol abuse in children. We've got door 43, We've got Sheffield Talking Therapies, we've got Daylight, which is that new app which Sheffield people can access. Have I forgotten anyone that's sort of health and well-being related? T2 Day. Sorry, I missed you, sorry. So yeah, please go and talk to them. They've got freebies. The drug samples do seem to be sealed, unfortunately, so you're not going to get any good stuff today. The other thing I've just been asked to mention, just for people that kind of sneak off before the end, is that the certificates, we've got to produce about 500. So we've just been asked to say, please be patient. If you've registered and signed in on the course, or if you're online and you've logged in, you will get a certificate, but it might take a few weeks. So I think the question was like, the ask of us was like, don't hassle them for a bit.